Hello, and thank you for attending the second part of this seminar. We're going to be talking about the actual Security Review Worksheet that we've developed to help in the process of reviewing your HIPAA security for the HIPAA security rule. So I'm sorry, there's a lot of text on here in this worksheet. The worksheet can be, if you'd like to have a copy of the worksheet, you can just email us at support@eckstromconsulting.com and we can get that worksheet off to you in a PDF format. So basically what this worksheet will do is it outlines all of the safeguards and requirements that you need to do to be HIPAA compliant. And then what we do is we define the actual HIPAA security rule itself, and we also then define some questions. At the outset, I just want to let you know that this worksheet was designed and outlined from sources that had summarized the HIPAA security rule. So CMS and HHS, the Human Health Services, had summarized the HIPAA security rule for someone to read, and I took it and summarized it even again. So it's really been distilled down now, and in a manageable process you can go through and work through this worksheet and become HIPAA security. I'm not going to go through each of these sections. We'll be doing that in our weekly HIPAA security rule tips of the week, but I will show you how to use this worksheet. So first off, you'll see this column or this row here. This is our reference. This is our, not references, this is our column or row where we have all of our headings. So this column is the rules, standard, and specifications column. This next column over are if the rule or the measure is addressable or if it's required. And then you have your HIPAA reference, which would be the actual text of HIPAA. And then far this column over are our summary questions. So these are the questions that you would be asked if you were doing this assessment. So you've read the HIPAA security documents, and then now you're asking, well, what does that mean? So as I spoke about in my previous presentation, there's three safeguards. There's the administrative safeguards, the physical, and the technical, as well as the other arrangements of the business associates agreements, the procedures and policies and documentation. Each section is highlighted in green here so that you know that you've come into a specific section. So in the administrative safeguards, we have the security management process. We have the, let's see here, we have the responsibility, assigned security responsibility section, workforce security, information access management, and then each of the specific standards that go along with those. So I will do one of these with you just so you get a sense of what's going on. So risk analysis, well, that's a pretty good one. Actually, that's probably the most important one we'll talk about. So in HIPAA, it basically says you'll conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity. Well, that is a mouthful, to say the least, and it takes about 4 times reading it over to understand. So to simplify things, what you should be doing is really coming over here and then asking yourself these questions. So in this risk analysis, you need to have a process to identify the potential security risks and determine the probability of occurrence and the magnitude of those risks. Well, I can do that. I can identify my security risks. I can determine how likely they are, how probable they are to happen, and I can determine the magnitude or the effect that those risks might have. And so some of the sample questions you could ask yourself: does my EPHI flow throughout the organization? And that means, does everybody in your office touch the EPHI in some way? If you have an electronic medical record system, that's probably true. They're built for information to flow through your network, your organization, from the check-in through patient care through billing. Everyone will be touching that patient EPHI. So you ask yourself a question like that. The next question you might ask are, what are the less obvious sources of EPHI? Well, you know you have your electronic medical record, and you know you have your practice management, and you know you have your scheduling system. What are you missing? Where is EPHI that you wouldn't think about? Oh, well, what about our lab system? It's in there. What about that doctor who takes home electronic records every night, who takes in Word documents? What about the retiring doctor who refuses to do EMR, but still does dictation, and it goes into an electronic file that gets sent to the transcriptionist? Those are all UPHI, and those are less thought of methods, but probably the most insecure and the most likely to get violated and to be exposed to the public. So, and then you get to have the fun things like your PDAs, your portable devices. Believe me, the bring your own device world has really changed things as far as security goes. Another question you might ask is, what are the external sources of UPHI? So, do you receive information from vendors, from consultants? Do you transmit between clinics? Do you transmit to regional health exchanges? And so, how does that information come into your office? What are the human, natural, and environmental threats to information systems that contain EPHI? So the human threat, someone will access information they shouldn't. They'll damage that information accidentally. They'll take the information for personal gain or for malicious intent. The natural threats, you could have things like electrical storms. You could have floods. The environmental threats, temperature, heat, humidity, these all affect UPHI. So, as you can see, the risk analysis section is probably one of the most rich and one of the ones you have to flesh out the most. So there's lots of questions to ask here. But this is basically what you can do: is you can go line item by line item through the spreadsheet and ask yourselves these questions. Write down your answers. That's the very first thing. And as you go through, you'll start to develop a sense of where your organization stands from a security perspective, and then you'll be able to come back and mitigate those issues. I do want to touch on the fact, though, that risk analysis is actually such a huge issue, but such a big part of HIPAA, that I've broken out the risk analysis down below, so we talk just about risk analysis. But I'll go through here in just a minute. So I'm going to just scroll through here briefly until I can show you the various sections. As you can see, it's rather lengthy, but still easily accessible. So there's, past that. There's our physical safeguards section, so we talk about our facility access controls and so forth. And next we're going to come up on our technical safeguards. There we are. And these are all the technical safeguards. Once again, R is required, A is addressable. And addressable means that you can, required obviously means required. Addressable means that you may not be able to implement a safeguard that will protect EPHI from that addressable threat. So what you'll have to do is you'll have to mitigate that threat in some way. Through logic, you'll have to determine, okay, I have a threat that I cannot buy, beg, or borrow a solution for, so what am I going to do to mitigate that? And you're going to reduce your amount of threat. And you're going to have to document what your logic was as far as why you only addressed it and why you didn't actually resolve the issue. Really critical piece there. Remember, everything's about logic and documentation. We just passed the organizational requirements, which basically consist of your business associate agreements or contracts, your agreements with your health plans, and there's policies and procedures and documentation. So in HIPAA, you want to have policies and procedures that cover all the things all the ways EPHI is touched, dealt with, managed, and controlled, so that your employees know how to, on a reproducible manner, to accurately and correctly touch their EPHI on an everyday basis. So they know what happens if scenario 1 happens, they know what the reaction is because they have a policy and a procedure. So going through this worksheet, you're obviously going to be starting to make notes of what your security risks are. You're going to work on how you mitigate those, and you're going to develop policies and procedures. The big thing that people really forget about is that you have to document why you did all of those things. So not only do you document the issues, you document how they are issues and are security threats. You don't only document how you're going to mitigate it, you document why you chose to mitigate it. Then you're going to document you not only document your policies and procedures by building them and keeping them, you're going to document why you chose that policy, why you chose that procedure. And then at the end, you're going to evaluate all of these things on a regular basis, dealing specifically with the effectiveness of the plan, and also as far as how the changes over time have affected your security plan, taking into account those changes. So now we get down to the risk analysis. This is probably the best part of the whole worksheet. What you're going to do is go line by line through here. This really breaks out the various parts of the risk analysis. So they're going to want you to determine your vulnerabilities, determine the types of threats, the natural, the human, the environmental, determine the risks. You're going to go through and identify the scope of your analysis. So how far are you going to look for? Are you going to have to take into account security in your clinic, or also in the homes of your physicians who take home medical information, or the businesses of your business associates, or the facilities of your regional health exchange? How far are you going to take this? So you have to define the scope. And then you gather your data, and then you document the potential threats and vulnerabilities, and you identify those threats, and you just work your way through this sheet. So one bit of advice: if you don't have a document somewhere, piece of paper, electronic, somewhere in your organization that says risk analysis, you are not HIPAA compliant. It doesn't have to say risk analysis for you to be HIPAA compliant, but if you don't have something that says risk analysis, you have not performed a risk analysis. And that is what they're going to look for, is that risk analysis is absolutely critical. So unless you have gone through and you have addressed every one of these topics in the risk analysis and have a piece of paper documenting that, you are not HIPAA compliant. You are exposed. You are at risk for getting fined. And then the second part of that is you also have to do your risk management process. So you need to have a document somewhere that says risk management process. And you, on that document, you write down or you document why or how you controlled, corrected, or mitigated threats to EPHI. So two things, if I'm going to have you take anything from this presentation, is if you don't have a risk analysis document and you don't have a risk management document, you are not HIPAA compliant. So we also then talk about meaningful use. So meaningful use deals with several of the HIPAA security rule standards, but like I said earlier, it fleshes them out a little more. So access control, you have to have a unique username and password. They define that, whereas HIPAA just has general guidelines. You have to have an emergency access plan. You have to have automatic log off. You have to have an audit log. You have to verify the integrity of the transmissions and of the data. You have to have authentication. So who's logging into the EPHI and what are they doing? You have to have encryption if you're sending across untrusted networks. And then you have to have encryption when you're exchanging information. Those items may have been optional or addressable in the HIPAA standards, but now they're required for you to meet meaningful use. So just a note. And then meaningful use stage 2. So as I mentioned in the previous seminar, meaningful use stage 2 talks about encryption of data at rest. That means data that is a backup, an archive, a copy. If it's not data in use, which is like the live database that you are accessing today and everyone's making changes to, that's data in use. I'm sorry, is it data in use? Yes. Data in use. And so let's see here, make sure I have my phrasing correct. Data in use, yes. So if it's not data in use, then it is data at rest. So if you have backup tapes, if you have offsite backups to a data storage location, if you're copying to a zip drive, to a laptop, to a thumb drive, I mean, if you've got a copy of it and it's data EPHI, it must be encrypted for meaningful use stage 2. That means either your electronic medical record will encrypt it, your backup software encrypt it, or you'll have to have a third-party tool to do the encryption. And this actually is probably, this measure in meaningful use probably comes from the fact that, well, actually they say it comes from the fact that there are so many devices, specifically laptops, with unencrypted EPHI, i.e. Word documents and Excel spreadsheets of patient records that physicians and providers are taking out of the clinics, that get stolen, and the physician now has had a breach, and that information is unencrypted. Whereas if it had been encrypted, then at the very least they could say that the data was encrypted and that the criminal would have to de-encrypt it, which is much less likely to happen. So this meaningful use stage 2 requirement, as far as encrypting data at rest, is now a requirement that HIPAA does not require. My My strongest suggestion to you would be that if you have a lot of data at rest, you really need to come back and evaluate why you have so much data at rest. If you have one backup, like onto a tape drive, or you have one backup to a data storage location, that's fine, or maybe even a couple of backups. But you shouldn't have things on thumb drives, floppy disks, USB drives, laptops. There's no reason. You should be sending that data to either protected, secured, off-site data storage locations, which are usually in data centers, which meet almost all HIPAA requirements, or you're dealing with it on a personal level, like a single tape drive or a single backup solution that one person manages. Please do not take your laptops out of your office or put information on your mobile devices, no matter how convenient it is. There are tons of very affordable, easily set up remote access technologies which will completely solve this problem for you. So just so you know, just below down here we talk a little bit about data at rest and some of the standards that it requires. And then there's 3 stages or states of data. So we have data at rest, which means it's the copy or it's an archive. Data in use, which means it's in a constant state of change. And we have data in motion, which means it's transmitting between systems. So just be aware, right now you don't have to address those or do anything. Those are just some little vocabulary words for you to know about. And then this presentation or this worksheet was gathered and condensed and defined by sources found in these various websites. So once again, thank you very much for your time. And if you have any questions, please feel free to email support@eckstromconsulting.com, or you can contact us at 406-730-5105, and you can choose option number 2 to speak with someone in the sales department. Thank you very much and have a great day.